So the independent parenting became a really important point. And an example here that I came across probably a few years into doing CAT-DAC assessments was that I had a gentleman who was flown in from North Bay for the assessment. And he had a young family, basically 3 kids ranging in age from 2 to 6. And so the kids and his spouse were sitting in our waiting room as I was interviewing him. And he interviewed very well. And he talked about how he had a little bit of trouble managing the kids, just a bit. For example, if the youngest, he would never leave the youngest in the bath alone, but neither would his wife, because the next oldest wasn't old enough really to be independent either. So the 2 of them had to be home giving bath to make sure the 4-year-old wouldn't be in trouble when the 2-year-old was having a bath. That's kind of all he really recognized. So my practice has always been, and it's again part of the manual procedures that we installed, was that you have to have a significant other interview. So in comes the spouse. Of course, the kids are too young to just be waiting in the waiting room by themselves, and none of our staff were able to manage them anyway. So the 2 to 6-year-old kids come in, and of course, as is not that uncommon even with non-brain injured husbands versus wives, she interviewed beautifully. I mean, I could ask her a question, and she was helping this child color, and then she was helping this one with a toy, and the other one she was helping read independently. I don't know how you women do it. But anyway, she didn't skip a beat. He wasn't being interviewed. And you could already see that he was overwhelmed by the chaos in that half an hour in a very controlled environment when he wasn't asked to do anything else but just to listen. It became so apparent that he was unable to independently parent these children. So a critical part, what I would encourage the OTs especially to do, and certainly our resident psychologists as well, if he has an opportunity to be able to observe the interactions between the patient claimant and family, young kids, very helpful. But please, OTs, try to build into your observation, your in-home assessment, that component. Ask for the family to be home, be present. If not for the whole thing, maybe if you have a first hour with the claimant on their own, and then afterwards have observation of the claimant interacting with the family, that can be very, very instructive. And minimally interview around that. If you can't observe the kids because they're in school, that's fine. But always interview on that very point. How does this claimant do in a variety of situations? Can they really independently parent? Are they ever left alone to independently parent?